Hey everybody, Matthew Mosier here. I hope you're doing great this holiday season. Please be safe out there. Celebrate any way that you can, even if it's only virtually. Wanted to give you a quick backgrounder as to why we're here on GoFundMe and YouTube. We're asking, my wife and I, we are asking for your help to grow our family. My story starts back in 2008 when I joined the Navy, and then after the training pipeline, I am assigned to the USS Columbus, a fast attack submarine, home ported out of Pearl Harbor, Hawaii. The great thing is that she was younger than me when I first met her over there in Pearl Harbor. Anyways, a couple months after I get there, I report to the Triple Army Medical Center with some weird symptoms, and due to the complexity of my case and the general complexity of minocycline-induced drug reactions, we did not appreciate the root cause as being minocycline. For another year and a half to 2 years, I continued then minocycline. Minocycline is normally a safe antibiotic for short periods of use after a hospital stay or for a local infection, but when you get chronic use of it for acne, that's when it has a tendency to cause these adverse drug reactions. So in the intervening time, I developed some hemorrhaging. Lucky for me, that hemorrhaging was down in my reproductive tract. I say lucky because I didn't bleed out, and it wasn't in a vital organ that killed me. So hey, I'm here talking to you today. That's great. That hemorrhaging in the hemospermia then continued until 2014, when my then fiance and now wife required me to get another opinion. I think this was 4 or 5. I really don't remember. Yeah, she's smarter than I am. I'm just a dumb dude. Anyways, the good doctors over at Nebraska Medical Center were able to do a transrectal ultrasound. They found the distension of my reproductive system and a cyst in my prostate, which was promptly removed. And after a short healing period, I was doing much better. The hemospermia resolved, and the pain that I was having on a daily basis also resolved. That's when we, or I should say my wife, conceived our son, a beautiful little boy who's almost, 4 years old, just turned 4 years old now. And everything's going great up until early summer of 2016, when I started developing some chronic pain. That pain worsened and worsened until 2018, when the Veterans Administration and the Nebraska Medical Center did a bilateral spermatic cord denervation. Kind of like a vasectomy, but instead of going in and trying to clip the vas, they go in and try and get all of the nerves to stop the pain from the distension and the previous trauma that I had with the hemospermia. So there they are, taking and cutting the nerves while maintaining all the good parts like blood flow and lymphatic systems to the testicles. So that unfortunately did not help me because of the previous trauma and the hemospermia, my blood-testes barrier, and the immune preference that the male reproductive tract has was violated. So my body came in to clean up the mess after that surgery and got a little rambunctious and was like, hey, we're gonna clean up this mess really good. Oops, we got a little bit too much there, got the nerves. So now any type of trauma, even touching, walking, peeing, pooping, a lot of things will cause me pain, especially because my incisions are closer to the base of the penis. Intercourse is impossible without pain. That has left me functionally infertile. After a lot of conversation with the VA, my wife and I were able to get into the IVF program due to the functional infertility that I have. Now, normally that's pretty good, but a lot of time had passed between our first son and getting in the IVF program, and of the 8 eggs that were retrieved from my wife and inseminated, 6 of them failed before third day of progression, and the remaining 2 had chromosomal abnormalities, and the one with the least chromosomal abnormalities, too, we tried to transfer and get it to implant in the hope that it was mosaic, and that the bad abnormal cells that were tested for would die, and the good cells and the good embryo would then continue to develop. Unfortunately, that did not take. So now we're left with the conundrum of about a 10% chance of successful reproductive success with our gametes. And that's where the VA program stops. We are required by that IVF program to only be able to use our own genetic material. Unfortunately, that's a law thing, and that's not going to change to help us, but I would invite you, if all you can do to help is call your senators and congressmen. The links to those 2 bills, House Resolution 955 and Senate Bill 319, are down below. So please help if that's what you can do for us. Even if it won't help us, it'll help other veterans. So now we're looking at either getting an embryo from other IVF patients who have successfully completed their family planning, or buying an egg in the hopes that my sperm is still sufficiently functional with a younger egg to then be able to achieve normal success ratios of 50 to 60% for IVF. So that's where we are. We're asking financial help to hopefully get a embryo donated to us, or if that doesn't work, to buy an egg and use my sperm for some of that batch. Otherwise, we would then be into having to use a sperm donor as well. So we're trying to cover our bases and asking for your help. So help in any way that you can. If you have any questions, please feel free to reach out. My case report is down in the links and the notes, as well as the 2 bills that we would like you to take action on, so that future veterans in this position would get the help that they deserve. So thank you very much for listening, and I hope you have a wonderful rest of your holidays. Thank you, thank you, thank you.